Recording progress.
Hello, my name is Juliet and I am one of the wellness coaches at the Priority Care Center. In this video, we'll talk about ways to manage diabetes. The ways to manage diabetes are to test your blood sugar, to take your medications as prescribed, to get regular physical activity on most days of the week, and to eat a healthy, balanced diet. So starting back at the top, testing as recommended, talking with your provider on when is ideal to test for you, and if there's any barriers to that. Sometimes cost can be a barrier, so talking with your provider. And what testing offers you is testing doesn't change your blood sugar, it tells you what it is at that time. And hopefully over time, it starts to help you identify patterns to which foods might be impacting your blood sugar the most. The next on the list is taking medications as prescribed. And if you're not taking them as prescribed, it's okay, knowing that that's just part of being human. And also letting your provider know that you're not taking them as prescribed, because most likely they've heard it before. And things like, I just can't remember to take them in the morning or at night or whatever the case may be, or it doesn't make me feel good after I take them, or it's too expensive, letting your provider know the reason, and then perhaps you two can brainstorm some ideas of what would make more sense for you to take it. It's just the most important that you're taking it. So figuring out how to do that. The next on the list is regular physical activity. So the recommendation for the basic recommendations for cardiovascular health, heart and lung health, is 30 minutes, being active for 30 minutes on most days of the week at a pace of a brisk walk. So if you are not doing anything, then just starting with, a short walk one time a week, that's a great place to start. And then seeing how that works for you. In addition to the 30 minutes on most days of the week, doing some strength training 2 days a week. So that could be, going to the gym and lifting weights, or doing yoga, or body weight exercises, or resistance bands, or free weights, dumbbells. There's a lot of different ways to come at that. The way that physical activity helps so much is because it lowers blood sugar. And the way that it does that is if there's too much sugar in the bloodstream, and the muscles are the tissues that need that energy, it doesn't work exactly like this, but for a visual, it works fine enough, that it just sends it over. It's like a vacuum. The muscles need it, the blood and arteries have the sugar, so it just kind of sends it right over to the working tissue, and it lowers the blood sugar. The last way to manage diabetes is to be eating a healthy, balanced diet. So there's a lot of ways to approach this. One of the simplest ways, in my opinion, is the plate method. And one of the best plates, in my opinion, is if you were to look up Harvard Healthy Eating Plate. And so that's a 9-inch plate. Half of the plate is non-starchy vegetables. The other side of the plate gets cut into quarters. So a quarter of the plate would be lean protein, and the remaining quarter is whole grain. So most of our grains aiming for whole grains. And the way that that helps manage diabetes is because if we're not eating too much sugar to begin with, then our body doesn't have to manage the excess sugar. We're just eating the right amount most of the time. So the Harvard Healthy Eating Plate is one way, or some people like to count carbs. That's another way. The Mediterranean diet is a wonderful diet to follow, or the DASH eating plan. Even some of the other ones like eating keto or intermittent fasting, or, paleo diet. They all have, if you've tried them, great. If they work, great. If they didn't work, that's okay too. Then that plan doesn't work for you, and you can just try something else. So those are the other ways to manage diabetes. Thank you.